Doctor.
Welcome back to Hello Doctor. Bipolar disorder is a mental illness that causes dramatic shifts in mood, going from episodes of mania, extreme highs, to depression, extreme lows, which is why it used to be called manic depressive disorder. Though it affects as many as 1 in 100 people, it's still considered taboo, or was, until award-winning journalist Elsabe Brits lifted the lid on the condition with a raw and personal account of her battle with bipolar disorder. Let's take a look.
I think it's very important that the family or anybody who lives with a person who is bipolar does as much research as they can about the illness, read up about it, that they talk to psychologists about it, that they talk to psychiatrists about it. I think it's also a good idea to perhaps go with the person to a psychologist so that you can be well equipped to know how to deal with it, if and when it does happen. How does one live with somebody who has this? It isn't always easy, but if you know that the person is doing their utmost to look after themselves and to avoid things that would trigger symptoms, that gives one so much hope.
Hope, not a word often associated with bipolar disorder, although the late Christopher Reeves said when you choose hope, anything is possible. And that really is the basis of your book, isn't it, Elsabe? Kyk my in die oë. Hope.
Yes, eventually. It started off with me being very ill, being admitted to hospital 3 times in 9 months. And the book, Kyk my in die oë, is a journey with me, and I hope eventually the story is about that people can identify with the story and it being universal when they read the book, that they can see, I know how she feels and it's my story too. And it's being patient with yourself and eventually being a functional working person with bipolar.
Elsabe, given the stigmas and stereotypes associated with bipolar, why would you write a book like this? Why would you tell people?
Well, for exactly that reason. But even before I wrote the book, it's been a journey for 10 years, and a lot of people already knew because I was open about my illness from the word go. As long as we encourage debate and we talk about these things, that people are scared about any disease from the chin up.
That's right. And so are doctors, let me tell you.
Yeah, and it's just a chronic illness, and it should be treated as such.
You talk about yourself not as being bipolar, but living with bipolar, describing it in the book as a monster, and yet still living full 8. What's the secret?
Yes, well, I use it metaphorically. I describe the illness as a monster, as a symbol, so that I can put it outside myself, so that I can live with it easier. But the secret is being patient with yourself. It's not a quick fix. It's not a silver bullet. It took me quite a while. It took me 2 years to stabilize. So the secret is very good psychiatry, medicine, very good clinical psychology, and taking ownership of your disease.
You talk about being patient with yourself.
Yeah.
What about the patience of others?
I think a lot of times people don't want to hear my child is bipolar or my spouse is bipolar. They look for other options. It must be something else. It's not this, or it's just a phase that you're going through, and it can be cured after 6 months, or it will go away, which is not the case. I think it's like hearing you have diabetes type 1. It's with you for the rest of your life. And as soon as you get through that, I think it's 90% won.
Acceptance.
Yeah, acceptance. And it's really hard because I think people start stopping their medication as soon as they feel better. But the secret is you feel better because the medication is working.
Elsabe, we know there's no cause for bipolar, nothing specific that we can put our finger on, obviously, but there are certain triggers that can bring it to the fore. And your trigger was a murder scene, wasn't it?
Yeah. A lot of people want to blame an event. Something happens and they say, well, it's an event. So you get through that, work with the trauma, and it will be gone. Well, mine was a murder scene. I've been to many murder scenes. As
a criminal journalist, not as the cause of the murder scene,
yes,
just checking. Yes,
as a murder scene as a journalist. But it would have happened sooner or later. That's also something that you need to work through. I was predisposed to get it. It would have happened 10 years down the line, maybe it would have happened sooner. It will happen. If you have a risk to develop it, it will happen.
Yeah. I want to ask you a very personal question here. What is your risk of suicide?
Yes.
Is that a threat in your own life?
Not anymore. Not anymore. I'm really dealing with the illness. I'm managing very well. But I'm sure that it's a very high risk if you're untreated out there and you're not getting help. The risk of suicide is very, very high.
If you had a friend who was recently diagnosed with bipolar, what would your words of encouragement be to them?
Definitely stay on your medication, go and see your clinical psychologist. Be patient with yourself, be kind with yourself, inform your family, and even take them to your psychiatrist, take them to your clinical psychologist, and talk about these issues. Inform yourself, and take ownership.
Elsabe, I just want to say thank you very, very much for having the courage to speak out about a condition that most people would rather not speak out. You do bring a lot of hope. Thank you.
Thank you.
I think Viktor Frankl said it, there's nothing in the world that can help one survive even the worst of conditions like bipolar disorder as the knowledge that there is meaning in one's life. Nietzsche said it. He said, he who has a why to live can bear with almost any how. Elsabe has a why. What's yours? We are still going to talk about the nitty-gritties of bipolar disorder in a moment, so stay with us on Hello Doctor.
Cipla will make it better.
So that was a very personal account of living with bipolar disorder, but let's take a step back for a moment and touch on the basics. Giselle, what are the signs and symptoms of a disorder like bipolar?
Michael, bipolar disorder is basically a disorder where a patient experiences significant highs or lows. And when we say highs, we mean episodes where their functioning really gets impaired. The patient would be restless, the patient would stop sleeping, they would be overactive, usually thoughts would be racing, mood would be elevated, or agitated, and I think Elsabe explained to us.
Hey?
Yeah, or grandiose.
Superhuman powers kind of thing.
Yes, people often think that they have superhuman powers, they a special messenger from God or whatever. So that's in the high phase of the illness, or in the manic phase. When they get depressed, it looks very similar to somebody with just a major depressive disorder. They will get extremely low, appetite will change, either they will eat more, they will eat less, sleeping pattern will change, energy levels low, and they will feel really hopeless and really down. So it's really these significant episodes of highs or lows that we see in the patients.
The two poles, as it were.
Yeah.
Why is it that people are afraid of mental disorders? And I'm not talking about this threat of suicide, because we can talk about that too, but, is someone with bipolar a danger to me and to my family?
I think that's a myth, that psychiatric patients are always dangerous people. And actually, if you look at the research, you'll see it's not true that psychiatric patients, have a significantly higher incidence of being criminals or murderers or whatever. I think it's just because it's the unknown, and people are afraid of what they don't know, and because it changes the personality or the way people behave, other people are scared. But patients actually, when they are treated, they can actually lead completely normal lives. And people with bipolar disorder, really they're nothing to be scared of. They're people who need help when they're unwell.
That's right. And they need treatment. So let's talk about how do you treat bipolar?
When you treat a patient, it's important to look at a few aspects. The one is medication, which is really important when it comes to bipolar mood disorder. The other one is psychotherapy, and I think that's something Elsabe also mentioned that she found quite valuable, was seeing a psychologist. And the other one is the psychosocial factors, is looking at the surrounds, relatives, support groups, any other thing that can help, or other aspects that can help the patient to comply with their medication and to lead normal lives. Medication is obviously where we come in. We have a few different medications on the market, and obviously with bipolar mood disorder, our mood stabilizers would be the most important medications. Even if patients have a depressive phase of their illness, one can add antidepressants, but it's very important that patients should stay on their mood stabilizers.
Sure.
That's the...
Normalizing is the goal here.
Yeah, it's the goal, absolutely.
What about prognosis?
That depends very much on how people comply with treatment, but when a patient takes the medication, sees their clinical psychologist, they have extra support, do everything they really should be doing, prognosis can actually be good as far as carrying on with their lives. We know that they're not going to be cured. The illness is not going to disappear. It's a diagnosis that's made for life, but they can lead normal lives, you know, when they take their medication and do all these things that I've mentioned.
So give us a little bit of hope here. I mean, as someone who deals with bipolar on a regular basis, what would your advice be to people suffering with bipolar?
I think I would say to people with bipolar, make sure that your psychiatrist, your psychologist, the people around you understand your illness as well as you do. Ask the questions like Elsabe said. And I think it's very, very important to comply with the people who are trying to treat you. There is actually a message of hope, and I would say that people with bipolar mood disorder can live an absolutely normal life on their medication. There's no reason why they should be seen as abnormal or patients with mental illness or anything like that.
Yeah. Like any other condition, as Azelle said, it's just a chronic illness that needs treatment. That's bipolar for you.
Hello, doctor.